Today, we're diving into a fascinating medical puzzle called Carcinoid Syndrome. It's one of those conditions where the body starts sending out all these strange signals that, at first glance, just don't seem to make any sense. Okay, so let me paint you a picture. Imagine someone suddenly gets this intense, really uncomfortable flushing in their face and neck. Maybe it happens after a stressful meeting, or even just a glass of wine. And at the same time, they're dealing with awful abdominal cramps and diarrhea that just won't quit. I mean, these things feel completely disconnected, right? But they're not. They are all pieces of the exact same puzzle. So what is the hidden connection? All right, so here are the clues laid out for us. That flushing is usually the first and most common sign, but it's got some nasty partners in crime. Abdominal cramps, ongoing diarrhea, and sometimes even wheezing, like in an asthma attack. But what's really wild is how specific things can set it all off. Emotional stress, certain foods, a little bit of alcohol. It's almost like a switch gets flipped inside the body and bang, all the symptoms hit at once. Now, you might think this is all just random bad luck. Well, it's not. Not at all. These symptoms are the direct result of the body getting flooded with a massive excess of some really powerful chemicals. This isn't some virus or bacteria attacking from the outside. The problem is coming from within. It's a case of the body's own chemistry just going completely haywire. Okay, let's unmask the chemical culprits here. The main offender, an overproduction of serotonin. Now, we usually hear about serotonin as the feel-good chemical in our brain, right? But in the gut, it's a totally different story. It makes the smooth muscles contract like crazy, and that's what causes those intense cramps and diarrhea. And at the same time, you've got these other troublemakers, like histamine and bradykinin. These guys are what we call vasodilators. They make your blood vessels expand really wide, really fast, leading to that dramatic flushing. So, we've identified the what, the chemicals that are causing all of this chaos. But that just leads to the next, much bigger questions, doesn't it? Where on earth are they coming from? And why is the body suddenly pumping them out in such huge amounts? And the source, well, it's something called a neuroendocrine tumor, or a NET for short. These are pretty unusual tumors. They're often very slow growing, and they come from special cells called neuroendocrine cells. We have these cells all over our body, but a lot of them are in the GI tract. And these particular tumors are what you'd call active, meaning they're like little factories, churning out and secreting hormones and chemicals, especially serotonin. But wait, it's not that simple. Just having one of these tumors isn't actually enough to cause carcinoid syndrome. And this is where the real twist in the story comes in. It's not just about the tumor itself. It's all about its location, and more importantly, where it spreads, that changes literally everything. Okay, this right here, this solves the entire case. Check this out. When that serotonin-producing tumor is just in the intestine, it releases all those chemicals into a blood vessel that goes straight to the liver. And our liver is a master filter. It sees that serotonin and immediately destroys it. So the patient has a tumor but zero symptoms. But if that tumor metastasizes or spreads to the liver itself, everything changes. Those new tumors in the liver now dump serotonin directly into the main bloodstream. The liver's filtering system gets completely bypassed. And that exact moment is when carcinoid syndrome and all its miserable symptoms finally begin. So, with the mystery of how this all happens solved, the next question is, how do doctors actually prove it? This brings us to the diagnostic trail, the clever methods they use to confirm what's going on. The primary tool in their detective kit is the 5-HIA test, and it's a remarkably specific process. First, for 3 days, the patient has to avoid certain foods that are naturally rich in serotonin. We're talking bananas, tomatoes, walnuts, because you don't want a false positive. Then, on that third day, they have to collect every single drop of urine for a full 24 hours. From there, the lab measures the level of something called 5-HIA, which is basically what's left over after your body breaks down serotonin. And when the results come back, they are usually black and white. There's no gray area. A normal person puts out less than 10 milligrams of this stuff a day. But someone with carcinoid syndrome, they're often pumping out over 50 milligrams a day. It's a massive, undeniable chemical signal that says, hey, there's a serotonin factory working overtime somewhere in here. All right, once the diagnosis is confirmed, the focus totally shifts to treatment. And today, doctors have a really robust, multifaceted playbook for managing this very complex syndrome. You really have to tackle this from multiple angles. First up, you've got to control those debilitating symptoms. There are drugs called somatostatin analogs that are fantastic at shutting down the tumor's hormone factory, which brings huge relief from the flushing and diarrhea. Now, if it's possible, surgery to remove the main tumor can actually be a cure. For cancer that's already spread to the liver, there are other cool options like debulking surgery or targeted therapies like TACE and PRRT that manage the spread, relieve symptoms, and help prolong life. And then for more advanced disease, you have systemic therapies like chemotherapy. Now, I know what you're probably thinking. You hear words like tumor and metastatic disease, and you expect a really grim prognosis. But here is one of the most surprising things about this condition, and this comes straight from the source material. Even with disease that has spread, these NET tumors are typically so slow growing that a long survival is actually pretty common, 10 to 15 years. Just let that sink in for a moment. That number completely reframes the whole narrative, doesn't it? It really underscores that while carcinoid syndrome is absolutely a serious condition caused by cancer, the underlying disease is often an incredibly slow-moving one, which allows for many, many years of management and life. So there you have it. We've unraveled a puzzle that connects flushing, diet, and the body's master filter, the liver, all leading back to a slow-growing tumor. It's just a powerful reminder of the mind-bogglingly complex systems that are always at work inside of us. It really makes you wonder, what other conditions are out there, hiding in plain sight, just waiting for us to connect the dots?